Welcome eChai, information for your best life. Now, here's Amy Chai.
Hello, everybody, and welcome once again to Speak Life. Today, we're going to talk about a topic that may be a little bit touchy for many of us, and that is the question, am I drinking too much? And we all know that it's wine o'clock somewhere, so it's time to start thinking about how much alcohol is too much alcohol. So I know you all remember COVID. How could we forget, right? So during COVID, they had essential businesses and non-essential businesses. And it turns out that liquor stores were considered an essential business. And I totally was on board with that as a physician because I know that as soon as people who are really heavily tolerant to alcohol and who are using alcohol very heavily, if suddenly they're cut off from an alcohol supply, we would probably have a lot of people in the emergency room with withdrawal symptoms. And these people would be catching COVID from the COVID patients and overwhelming our hospitals. So I did actually agree with that policy decision when it was made. But every decision comes with, unintended consequences. And one of the unintended consequences of this was that a lot of people started drinking a whole lot more during COVID. And it happened to us too, as physicians. I'll give you an example. A lot of our meetings were conducted over Zoom. And one of the popular things to do, because we couldn't meet together in person, was to send an invitation to all the members of the meeting with like a bottle of bourbon and say, well, let's have a Zoom meeting and a cocktail hour over Zoom. And then, you'd have that bottle of bourbon left over. So a lot of people were drinking a little bit more. And then when you think about it, you think about all those things that COVID brought into our world. It brought isolation. It brought depression. It brought boredom. It brought people who were sorrowing and having a lot of difficulty with loss of family members and with fear for their own health status. So COVID was really a huge stressor. And we know that when people are isolated, stressed, and depressed, they often self-medicate with alcohol. So if you're like many, many Americans, you probably are drinking a little bit more from COVID, and you may or may not have sort of held on to some of those habits. So today's question I'm going to have is, how much alcohol is too much alcohol? And is it time for Americans to cut down on alcohol use? So let me go ahead and go to my first slide. And that is statistics. So statistics show that, and this is 2021 statistics, that 28.6 million adults ages 18 and up, which is 23% of the entire United States population. 23%, that's almost 1 in 4, had been diagnosed with alcohol use disorder over the past year. So from year 2020 to 2021, almost a quarter of Americans had an actual alcohol use disorder. And by alcohol use disorder, I'm not talking about maybe heavy drinking or at-risk drinking. I'm talking about alcohol use disorder that could be diagnosed. And during that same time period, nearly 23% had binge drinking. And binge drinking is defined as having more than 4 or 5 drinks in a single setting. So these two statistics are pretty dramatic for American alcohol use. And by the way, America is number one. We're number one in alcohol use and also opioid use as well. So, what are the costs? What are the costs of all of this alcohol use? Well, we have some data right here that shows in 2010 that $249 billion were spent on treatment of alcohol use disorders. And 3/4 of that costs was due to the consequences of what we call binge drinking. And a lot of that would be, you know, accidents or pancreatitis or something serious happening. So that's a lot of money, and those are 2010 dollars. So that amount of money is certainly going to be higher now. We also know that alcohol contributes to about 18% of emergency room visits and about 22% of overdose deaths that also have narcotics from prescription opioids are also combined with alcohol. And that's why they say you should never, never, never combine opiates with alcohol because, as you can see, it's contributing to a lot of deaths because both of these substances decrease your breathing. And, breathing is just one of those things it's really important that we can breathe. So let's go ahead and switch out here and talk about, what is a drink? What is a drink? I have a can here, and this is a can that is about 12 ounces. Now, a 12-ounce can of beer or some other alcoholic beverages like a White Claw or something like that, that would be one drink serving. And if you have a glass with maybe 12 ounces of beer in it, that would be a drink as well. Another thing we would consider as a drink would be 5 ounces of wine. And wines do differ a little bit in alcohol content. So some of the stronger wines might be a little less than the 5 ounces. So 4 to 5 ounces we would consider to be a full serving of wine. And sometimes, depending on the size of your wine glass and the amount of pour that's in the glass, it can seem like you're not drinking as much as you are because you're just filling the glass a little bit higher. And finally, we have hard liquor, which would be, rum or bourbon or gin. Those type of alcohols, a 1.5 ounce serving is one serving. So it's important to be aware of the amount of alcohol that you're putting in your glass to tell if it's a full serving or maybe it's a double serving, because that's going to mess up your calculation of how much you're drinking. So here we have a list of what is the recommended maximum amount of alcohol use. And there's no there's no minimum amount that you can drink, and drinking regularly is potentially risky for people's health. For women, we have increased risk of breast cancer with frequent alcohol use. And of course, there's also the long-term risks to the body, including liver damage. And if you have diabetes, it can interfere with some of your medications. It can make your blood pressure worse. It can make your depression worse. And it can also contribute to sleep disturbances. And sometimes you can get a very serious problem called pancreatitis, which is an extremely painful and where your pancreas becomes inflamed. And that can be a very dangerous problem related to alcohol use. And these type of outcomes come when you're exceeding the maximum recommended upper limit of drinking. So pay close attention because right now we're going to learn what is my max. Okay. So this is recommended by SAMHSA. It is the amount which is unhealthy to go over. And if you're a woman, it's different than if you're a man because women and men, they metabolize alcohol a bit differently. So, in one day, a woman should not have more than 3 standard drinks, and a man should not have more than 4 standard drinks. So that's anything more than that, especially amounts that would get your blood level up to 0.08 blood alcohol concentration, which is where they do that little breathalyzer test. And they're like, oh, you're blowing 0.08. That means that you're legally intoxicated. And for men, it would typically be over 4 drinks. And for women, it would be typically over 3 drinks. So, what about weekly? Now, if you're a female and you drink your limit of 3 drinks every day, that would give you 21 drinks per week. So you can't do that every day because the weekly upper limit for women is 7 drinks per week. So that sort of averages out to about 1 drink per week for women. Now, for men, they have a little bit higher limits, and that's to be about 14 drinks per week. So, drinking this amount is a regular drinking. If you're drinking this amount regularly, then you actually may be considering cutting down a little bit. But any more than that, you probably should be thinking about cutting down a little bit. So let's go ahead and move on to the next one. And that is, am I at risk? Well, there's something called a lifetime prevalence of alcohol use disorder. And I already talked a little bit about the difference between at risk versus alcohol use disorder. We used to call alcohol use disorder alcoholism, but we don't really call that anymore. We call it alcohol use disorder. And there's people who are at risk, and then there's people who actually have the disorder. And so we kind of have to tease that out to determine whether or not you need to cut down or whether or not you need to get help from a professional. So almost 30% of Americans at some time during their life will have alcohol use disorder or alcoholism. 30%. That's a lot of alcohol in the United States. And as we saw from the other slide, over the past 12 months, that number was closer to 10%. 10 to 11% will have had alcohol use disorder in the 12 months prior to the survey that they took. So at any given time, about 10% of American adults have alcohol use disorder. That's 1 in 10, and that's pretty big. So how do you know when you're starting to have a problem with alcohol? How do you know that? Well, we know that, denial is a big thing, and, people don't want to hear it. They don't want to talk about it. But here's on this slide a few things that may put you at risk of alcohol use disorder. Now, the first thing up there is, of course, thinking a lot about alcohol, and that would be alcohol cravings. The second would be having a high tolerance for alcohol, like you can drink a lot without feeling it. Third would be having a lot of risk factors for substance use disorders, things like being depressed, under a lot of stress, having a lot of things going on in your life, being isolated, being sad. Caregivers are at high risk for alcohol use disorders. So these are all risk factors that you should really think about when you're thinking about substance use disorders and your risk for alcohol use disorder. Another telling thing is if you can't make it through a time out or a time off from alcohol. Say you want to maybe go a week or a month without drinking at all, and you really struggle. Maybe you can't do it at all. That's a tip off that you're at risk for developing alcohol use disorder. So, if you really want to think about if you are at risk, try taking 2 weeks off and just say, you know what, the next 2 weeks, not going to drink any alcohol at all, and see how hard it is for you. How difficult will it be for you to maintain abstinence just for 2 weeks? And if it's really challenging, you may start to think about your relationship to alcohol and if it's healthy for you. Um, and finally, another risk factor is that you've really started drinking more than you intended. Maybe you think, oh, I'm just going to have 1 glass of wine, but then it ends up being 3 glasses of wine. And you're like, oh, I just meant to have 1 glass of wine. That is a problem. It means that you're starting to lose a little bit of that control over your use of alcohol. So these are some red flags to say if you're drinking more than the maximum that we saw in the last slide, or if you're having any of these problems like thoughts about alcohol, you're drinking more than you intended, you have a hard time staying away from alcohol. Um, these things mean that you are at risk and you should probably start thinking about cutting back. So, what if you do want to cut back? Is it hard to cut back? Is it easy to cut back? Um, there's some new research out there that you have got to hear. And this is just really, really interesting. I'm going to pull this slide up. Remember in the show that we did talking about the hunger hormone ghrelin? That is a hormone that's made in your stomach and it causes your brain to feel hungry. Okay. Ghrelin. And that is a mean, mean hormone. It makes you want to gain your weight back if you lose it, it makes you want to eat more. But there's something really, really interesting about ghrelin, and that is if you take ghrelin, the hunger hormone made in your stomach, and you put it in an IV and you drip that ghrelin into a patient, that patient will develop acute cravings for alcohol. Isn't that interesting? And there is a link between carbohydrate cravings, sugar cravings, and cravings for alcohol. And it seems as though ghrelin may have a part in that connection. So, what are some things in your life that may be increasing your ghrelin levels? Well, we know that stress increases ghrelin. It acts in the brain and it disrupts the adrenal hypothalamic axis. It messes up your hormones. The stress, you have the cortisol and you have the adrenaline and you have ghrelin. And ghrelin goes up when you have stress. And that is the hunger hormone, and it's also the alcohol craving hormone. And there's another thing about ghrelin, and that is that if you are obese, you may not have high levels of ghrelin, but you actually have increased sensitivity to the ghrelin. So a little bit of ghrelin goes a long way if you're obese, and that may be part of the pathophysiology or the cause of obesity. And it may also impact cravings for alcohol. Another thing that increases ghrelin is insomnia. If you have sleep disturbances, if you're working really long hours, you're not getting any sleep, well, that is increasing your ghrelin level. And of course, who can possibly forget dieting? Ghrelin is that dieting hormone because as soon as you lose the weight, you hit a plateau and the ghrelin comes in and it makes you hungry. And it also makes you crave alcohol. Isn't that interesting? But you know what's even more interesting? Pfizer, our ever popular Pfizer, big pharma, came up with something called a ghrelin blocker. It's a drug that blocks the effect of ghrelin. And it is not FDA approved. It's an experimental drug, but people from the addiction sphere wanted to borrow this drug from Pfizer to do an experiment. And the experiment that they did was to give the ghrelin blocker to people. And that's exactly what they did. And this ghrelin blocker actually reduces not only your appetite, but it also reduces cravings for alcohol. So stay tuned. This new drug may help really reduce cravings for alcohol. And I kind of wanted to bring to your attention, stress, obesity, insomnia, dieting. Does that sound familiar to anyone? It's like it's so common that we're stressed and we're dieting and we have trouble sleeping. These are problems that we all face. And these are things that increase our ghrelin level, but not only does it make it have trouble losing weight, it also makes us crave alcohol. So how are we going to decrease ghrelin? Um, One of the most important ways to decrease ghrelin is to eat high protein, low carbohydrate meals. And that doesn't mean you have to go into ketosis or do a keto diet. It just means to focus more on protein. So if you have those almond snacks, if you have that Greek yogurt, if you have those protein drinks, those are things that are going to help curb your hunger and reduce your ghrelin levels. Another thing, obviously, since insomnia and disordered sleeping causes increased ghrelin levels, it only stands to reason that getting good sleep every night, at least 7 hours, is going to help to lower the ghrelin levels. Another thing, and good luck with good luck with this one, people. I can't help you with this one, but reduce your stress level. It's not easy to reduce your stress level, but we even when we have stress, sometimes the things we do can relieve stress a little bit, like taking a nice walk outside, getting together with friends, maybe practicing yoga, taking a warm bath. These are all things that can decrease how you perceive your stress, even though the stress itself is probably not going to go away anytime soon. And another thing that's important is to avoid yo-yo dieting because yo-yo dieting it really makes ghrelin build up in your body so you constantly feel hungry. And you may also constantly feel cravings for alcohol. So these are some tips for you. And it's really common sense too, because it's all about healthy eating. But it's so interesting because what this really means is that behaviors and healthy eating and alcohol cravings and all those things that we think about them as behaviors, but in actuality, they're heavily, heavily influenced by hormones. So here we get kind of to the heart of the matter. And the heart of the matter is that alcohol use, much like other kinds of substance use disorders, is heavily, heavily stigmatized in our world. But yet, so much of it is due to choices that we make that are heavily influenced by the hormones in our bodies. And healthy living is really a challenge. But what I feel, and I say this again and again, healthy living depends so much on your mental health. So, what can you do if you really feel like maybe you should cut down on drinking? Maybe you're not at alcohol use disorder level yet, but you're worried that it may end up that way. That's where you should try cutting down a little bit on your alcohol use. And, we recently had in the news a story of a legislator who apparently had been drinking heavily, was speeding the car in Hartford, and actually flipped the car over. This is what binge drinking can do. And that's why people end up dead. They end up in the hospital. You don't want that to happen to you. That's certainly evidence of, alcohol use disorder. Another thing that would certainly be indicative of alcohol use disorder would be if you start to have withdrawal after stopping. Say you want to take the 2-week challenge. Just take a 2-week challenge and say, what'll it be like if I don't drink at all for 2 weeks? Well, after 2 or 3 days, do you start to feel shaky? If you're starting to feel shaky, maybe a little bit sweaty, um, maybe your pulse is going up a little bit. These type of symptoms can be a sign that you're going into alcohol withdrawal. And alcohol withdrawal, I want to make sure that you know, alcohol withdrawal can be life threatening. There's You can get something called delirium tremens. You can get seizures, hallucinations, very, very serious alcohol withdrawal symptoms. So, if at any time trying to do a 2 weeks of abstinence, you start to feel a little shaky, then by all means, head right over to the emergency department because there are treatments for that. Oftentimes, they'll give certain types of, like a Valium type of a drug, to help to relieve the symptoms of withdrawal, and then they would monitor you very closely. And if at any time you got very ill, you would certainly need to be admitted to the hospital. So I just want you to be very, very aware. If you're trying to cut back on alcohol, please, please be aware of withdrawal symptoms. And if you start to develop any of those withdrawal symptoms, especially starting out getting the shakes, getting sweaty, feeling nauseated, just go to the emergency room. Just go. It's not worth taking the risk of having a seizure or something even worse. So that's why I would never tell someone just to cut out alcohol without warning them beforehand to watch out for potential withdrawal symptoms. So enough lecture of that. Um, COVID was here, and COVID is, well, the worst of it's over, I hope. But it's time to get back to normal. It's time to think about our health in the long term. And for a lot of that's going to mean cutting back a little bit on our alcohol consumption. So I hope that you're willing to try some of these ideas, eat more protein, take a 2-week break and see how you do. Be sure to stay within the limits of the maximum that you saw on this table that I presented. And soon you're going to find that you're feeling a little bit better. But now you have the tools that you need to tell if you need to go and get a little bit of help. So That's today's talk on Speak Life New Haven. Do I need to cut down on alcohol use? The only one to know the answer to that question is you. So we'll see you next time on Speak Life New Haven.
Tune in next time for Speak Life with Dr. Amy Child at ctpolitics.tv.